Amnesia and how memory loss operates. In the vast landscape of human cognition, memory stands as a cornerstone of our identity and functionality. Yet, for those afflicted with the amnesia, this fundamental aspect of human experience becomes a web of uncertainty and losses. In this video, we will delve into the intricate world of amnesia, exploring its multifaceted nature and the underlying mechanism of memory loss and the cutting edge research that continues to shape our understanding of this enigmatic condition. The architecture of memory. To comprehend amnesia, we must first navigate the complex architecture of the human memory. Far from being a monolithic entity, memory is a sophisticated system comprising multiple interconnected processes and structures. So let's start with the short-term memory, the fleeting gateway. The short-term memory, also known as working memory, serves as a mind's temporary workspace. It holds and manipulates the information for a brief period and typically lasting 15 to 30 seconds. This system is crucial for the immediate cognitive task but has limited capacity, often described as holding 7 plus minus 2 items. Next, long-term memory, the vast repository. So long-term memory, in the contrast, is a seemingly boundless storehouse of information capable of the retaining data for extended period of time, potentially throughout one lifetime. It encompasses two primary subdivisions. First, declarative memory, which is episodic memory, the personal experiences and events. Semantic memory, which is general knowledge and fact. Procedural memory, which is skill and procedures learned through the repetition. And next is the consolidation process. The journey from short-term to the long-term memory involves a process known as consolidation. This intricate mechanism, orchestrated primarily by the hippocampus in the conjunction with other brain regions, transforms fleeting experience into the enduring memory. Understanding this process is crucial for unraveling the mystery of amnesia. The disruption in the consolidation often lie at the heart of memory impairment. So what are the spectrum of amnesia? So amnesia manifests in the various forms, each presenting unique challenges and insight into the nature of memory. Let's start with the introgate amnesia, the eternal present. So individuals with introgate amnesia struggle to form new long-term memory after the onset of their condition. While they can often recall events from their past, their ability to create new memory is severely impaired. This form of amnesia provides a window into the mechanism of memory formation and critical role of the hippocampus in this process. Next, retrograde amnesia, the fading past. So retrograde amnesia involves the loss of pre-existing memory, often following a temporal gradient where recent memory are more affected than the distant one. This pattern offers insight into the disturbance and consolidation of memory over time and challenging our understanding of memory storage and retrieval. Next is transient global amnesia, a temporary void. So this rare and fascinating form of the amnesia is characterized by a sudden onset of memory loss, typically lasting less than 24 hours. Its transient nature raises intriguing questions about the resilience and plasticity of the memory system. And next is dissociative amnesia, the mind's shield. Rooted in the psychological trauma, dissociative amnesia involves the suppression of a specific memory. This form of amnesia highlighted the complex interplay between emotion, stress, and memory, offering a unique perspective on the mind's perspective mechanism. So what are the neurobiological foundation of amnesia? So study of amnesia has been instrumental in the mapping in the neurobiological underpinning of memory. Key brain structure and processes implicated in amnesia that includes first the hippocampus, a memory gatekeeper. So central to the formation of declarative memories, the hippocampus play a crucial role in consolidating the information from the short-term to long-term memory. So damage to this structure, as famously observed in the patient HM, can result in profound intrograde amnesia, illuminating its critical function in memory formation. Next is the temporal lobes, which is repository of experiences. So the temporal lobes, housing a structure like the hippocampus and amygdala, are integrated to long-term memory storage and retrieval. Lesson in these areas can lead to both intrograde and retrograde amnesia, offering insight into distributed nature of memory storage in the brain. And next is prefrontal cortex, the executive of memory. While not typically associated with the classical amnesia, the prefrontal cortex play a vital role in the working memory and executive function. Its involvement in the memory processes underscore the interconnected nature of cognitive function and their vulnerability to disruption. Now we'll talk about the neurotransmitter system, the chemical messenger. So neurotransmitters, particularly acetylcholine, play a crucial role in the memory formation and retrieval. Disruption in these chemical signaling system can contribute to memory impairment, highlighting potential avenues for pharmacological intervention. What are the etiology of amnesia? A multifaceted landscape. The causes of amnesia are diverse, reflecting the complexity of memory process and the vulnerability of brain to various insults. So neurological factor. So traumatic brain injury, a stroke to transient ischemic attack, encephalitis and other infection, hypoxia, which is deprivation of oxygen, neurodegenerative disease like Alzheimer, certain medication and substance abuse. Next, psychological factor. So psychological factor may be like severe emotional trauma, dissociative disorder, stress-induced memory suppression. So understanding this etiological factor is crucial to developing targeted intervention and preventive strategy. Now we'll talk about the diagnosis and assessment. Unraveling mystery. Diagnosing amnesia requires a comprehensive approach, combining various assessment tools and techniques. So we'll start with first clinical history. So gathering detailed information about oneself, progress and context of memory loss. And the second is neurological examination. So assessing overall brain function and identifying potential neurological deficit. And third diagnosis is cognitive test. So employing a standard test to evaluate different aspects of memory and cognitive function. Fourth diagnosis is neuroimaging. So utilizing MRI, CT scan and functional imaging technique to visualize brain structure and activity. Fifth diagnosis is electrophysiological studies. So using EEG and other technique to assess brain electrical activity. And sixth is psychological evaluation. So assessing emotional and psychological factors that may contribute to the memory impairment. This multi-phased approach not only aids in the diagnosis but also provides valuable data for research and treatment planning. Now we'll talk about the treatment frontiers. So navigating the path to recovery. While amnesia presents significant challenges, advances in the neuroscience and psychology have opened new avenues for treatment and management. Let's start treatment with the cognitive rehabilitation. So tailored program aimed at improving memory function, developing compensatory strategies have shown promise in the helping individual with amnesia navigate daily life. And these approaches often leverage preserved ability and procedural memory for build a skill and routines. Next is pharmacological intervention. While no single drug can cure amnesia, certain medication may help manage underlying condition or enhance cognitive function. So research into memory enhancing drug and the neuroprotective agents continues to evolve, offering hope for more targeted treatment in the future. So next treatment option is neurostimulation technique. Emerging technologies such as transcranial magnetic stimulation, which is TMS, and deep brain stimulation, that is DBS, are being explored for their potential to modulate brain activity and enhance the memory function in certain types of amnesia. And next is psychotherapy. For cases of dissociative amnesia or where psychological factors play a significant role, various forms of psychotherapy can be beneficial in addressing underlying trauma and facilitating memory recovery. And next treatment option could be lifestyle modification, emphasizing the importance of sleep, stress reduction, physical exercise, and cognitive engagement in supportive overall brain health and potentially mitigating memory impairments. Now we'll talk about the living with amnesia, adaptation and support. The impact of amnesia extends far beyond memory loss, affecting personal relationship, professional life, and overall quality of life. The strategy for coping and adaptation include. So let's talk about the strategy for coping and adaptation. First, environmental modification. Creating a structured, supportive living environment that reduces confusion and enhance independence. And second, assistive technology. Leveraging digital tools and a smart device to aid memory and daily function. Third, social support network. So engaging family, friend, and the healthcare professional in creating a comprehensive support system. And fourth, identity preservation. So developing a strategy to maintain a sense of self and continuity despite memory gaps. Fifth, emotional resilience. So addressing the psychological impact of memory loss through counseling and support groups. Now let's talk about the research horizons, the future of amnesia study. The field of amnesia research continues to evolve, driven by a technological advancement and the interdisciplinary collaboration that include neuroplasticity and recovery. So investigating the brain capacity for reorganization and compensation offer hope for developing more effective rehabilitation strategy. Next could be precision medicine approaches, tailoring treatment based on individual genetic, neurobiological and environmental factors to optimize the outcome in amnesia patients. And next could be advanced neuroimaging. So developing more sophisticated imaging techniques to visualize memory process in real time and track the progression of memory disorders. And next could be artificial intelligence and big data system. So leveraging machine learning algorithm to analyze the vast data set, potentially uncovering new patterns and insight into the mechanism of amnesia. And the next option could be stem cell therapy and regenerative medicine. So exploring the potential of stem cell to repair or regenerate damaged brain tissue, offering new hope to treating certain form of amnesia. Now I would like to conclude here for unfolding the tapestry of memory. So amnesia, it's the myriad form, continues to challenge our understanding of memory and consciousness. As we unravel its mystery, we gain not only insight into the nature of memory loss, but also a deeper appreciation for the complex working of the human mind. The study of amnesia serves as a powerful lens through which we can examine the fundamental question of identity, consciousness, and nature of human experience. It reminds us of the fragility and resilience of the brain, the complex interplay between biology and psychology, and the enduring human spirit in face of cognitive challenges. As research progresses, we move closer to unraveling the enigma of amnesia, offering hope for more effective treatment and deeper understanding of very essence of human memory. In this journey, each discovery not only illuminates the path forward in the amnesia research, but also shed light on the broader landscape of neuroscience and cognitive psychology. The story of amnesia is far from completed. It is a narrative that continues to unfold, challenging our assumption inspiring new questions and driving us towards a more profound understanding of human mind. As we stand on the brink of new discovery, the field of amnesia research beckons us forward, promoting not only advance in treatment but also fundamental insight into nature of memory, consciousness, and human experience. So thank you for watching and see you in the next video.